Hi, good afternoon, everyone. Derek Anderson here, Executive Director of Northern Westchester Hospital, Northwell Health here in Mount Kisco. We welcome you this evening to what is an incredibly special milestone for us here at Northern and for our community. For 105 years, this hospital has been a leader and a pillar for outstanding medical care and great outcomes, quality, patient experience for this community. And today and this week marks another milestone on what is a journey to bring more sophistication to Northern Westchester here in Mount Kisco and in effectively our backyard. And with that, it is the opening of our cardiac catheterization lab. This is a part of the Seema Boesky Heart Center, and we are grateful for Seema as a leader in this community, helping us to make this project come to fruition. I am joined today by two of the leaders of our cardiac cath program that we'd like to introduce you to in this community. The first is Dr. Carl Reimers. Carl, if you could just raise your hand. Dr. Reimers is formerly of Lenox Hill Hospital. Lenox is a part of the Northwell Health family. Carl spent the last 15 years of his professional career at Lenox Hill building and developing what is one of the premier heart centers in Manhattan for the last several years in the top 5% of all cardiology services, health grades in the country. And so we're lucky to have Carl as a resident of our community, as well as really a top cardiologist. To Carl's left is Dr. Garvey Rene of Caremount. And we welcome Dr. Rene as the associate director or the co-director of the program, along with Dr. Reimers, and to have two outstanding physicians right here in our backyard leading what will be a world-class cath lab. And we're gonna get into what is a cath lab and what you can expect from a community standpoint. We are excited to welcome these two prominent physicians to the webinar today and to effectively our cath lab. So on Wednesday, September 2nd, 2 days from now, we will be officially operating full-time 24/7 a cardiac catheterization lab. And I'm gonna let Dr. Reimers and Dr. Rene explain what that is a little bit further in just a moment. This is a big milestone for us as we think about bringing advanced care local to our community. Why travel into the city or long distances if you don't have to? And so the drive of this cath lab and the drive of the program is to have superior outcomes close to home, where in a situation, every moment matters. In the case of a heart attack or an active cardiac event, getting to the closest center could mean life or death. And for us, it's a worthy endeavor. And I want to recognize again, Seema Boesky, our benefactor, that really helped us make this program possible through a pace-setting gift. And we're grateful for Seema as a leader in this community. And so the Seema Boesky Heart Center is officially opening this week. Wednesday is the first official day in the lab. And what that means really is patients that arrive here at Northern or patients who are seen in the community who need more advanced cardiac care in a cardiac lab can now be seen at Northern Westchester Hospital. So with this, I'd like to hand it off to Dr. Reimers to just give a quick kind of introduction of himself, anything I may have missed, and then Dr. Reimers, anything else you want to add kind of introductory to why is a cath lab important for this community, and maybe explain what is a cath lab for those who may not know.
Thank you, Derek. Thank you very much. So a cardiac cath lab is essentially a X-ray suite as well as an intensive care unit all in one. And that's for the diagnosis and treatment of acute coronary syndromes especially. So starting Wednesday, we have elective cases, meaning cases that need coronary angiography that are the kind that can be electively scheduled. That said, as of Wednesday morning, anybody who has an acute situation, they're coming in with a heart attack or a near heart attack, we would be able to take care of. Again, you're quite right, Derek. Once we open on Wednesday, the Cath Lab is open 24 hours a day, 7 days a week, 365 days a year. And there are 4 well-trained interventional cardiologists. I believe their pictures are being shown. Besides myself and Dr. Rene, there's also Dr. Bassman and Dr. Rashid. Both of these doctors were trained at Lenox Hill Hospital along with me. I was the director of the Cath Lab for a number of years at Lenox Hill before becoming the vice chairman. And I can tell you that both Dr. Bassman and Dr. Rashid are extraordinarily well-trained physicians. We're very, very excited. We think this is going to be a very important thing for our community. The doctors, by and large, will also be rotating and doing some higher risk elective cases at Lenox Hill, which allows for, ongoing education, which is outstanding. But there's always someone here in case of emergencies, and we're very excited about this. This area honestly has been underserved for acute coronary care. So many of these patients who are picked up by EMS and have heart attacks end up going to Connecticut or down to Westchester Medical Center. And so there's a large area here. And I think that Westchester EMS thinks that there are at least 200 patients per year in acute settings who will benefit from this Cath Lab availability.
Excellent. Thank you, Dr. Reimers. And I think it's worth noting, I mean, even one life that can potentially be saved because of the travel distances and bringing this service here to Northern is certainly why we're all doing this and why we're here. Dr. Rene, could you also introduce yourself and anything else you want to add? Dr. Rene is, again, the Associate Director of the program. I also want to mention before, Dr. Rene, before I hand off to you, for those of you who are joining us via Zoom or via Facebook Live, please go ahead and post in the Q&A section of Zoom, as well as in Facebook. And we're going to try and capture some of those questions and funnel those for Drs. Reimers and Rene. Garvey?
All right. Thank you, Derek, for the introduction. So as many of you may know me already, I'm Dr. Rene. I've been the interventional cardiologist for CareMount, which is one of the biggest medical group affiliated with Northern Westchester Hospital for many years. This has been our home-based hospital for many years in that sense. So it is a blessing. We're very happy that as CareMount, with our partnership with Northern Westchester, to have an ability to bring a lot of our patients, to provide our patient this care that frankly, a lot of them have been asking for a long time. Okay, now we'll be able to provide cardiac catheterization, like Dr. Reimers mentioned. We'll be able to provide the acute care services for patients having heart attacks or before they have a heart attack. We'll be able to help stabilize them with heart rhythm abnormalities, and also, will be the first step, a connection to Lenox Hill if they need something such as more advanced cardiac surgery. In that sense, so that's very good. That's a great blessing for our community in that sense. So we'll be, again, available 24/7, 365 days a year. We'll be there. We have a great team like Dr. Reimers mentioned, and we're ready to go live. So we really look forward to be able to provide this service for a patient, no longer needing to go to the city or go to a different hospital in the region if they need to get, more advanced cardiac care. So this is definitely taking it another step to another level at this point.
Excellent. Dr. Rene, can you elaborate on the cardiac surgery piece? There's a question from Herbert on the Q&A. Will cardiac surgery be available? And can you just make that distinction between our Cath Lab and cardiac surgery?
Absolutely. So In the Cath Lab, we're able to do what's called some minimally invasive procedures. And first of all, things such as percutaneous coronary interventions, which include stenting for heart attacks, stenting for elective procedures, stable angina, and things of the sort. However, there are a subset of patients, which we estimate will be about 10% of the patients that we encounter, that may need more advanced procedures, such as bypass, which is also called coronary artery bypass graft or CABG. Those require open heart surgery or more advanced surgery. This has to be done at a more tertiary quaternary care center, and this is where they'll have the expertise of the Lenox Hill surgeons, which will be on a first name basis at all times. So we'll have direct access to that. I mean, the patients need to get it, whether it's urgently or an elective basis, we'll be able to provide them with this access, connect them with this access and that sort. So we'll be able to take care of 90% of the cases that come in through the door, but of course, there's always a small subset of patients. So same thing for patients who need valve surgery. The valve surgery we won't be able to do in this facility. However, if they need to do it, we can do it for them at Lenox. We'll be able to provide them with that service and connect them with the surgeon at Lenox to do this.
Thank you. And just to add to that, Lenox Hill Hospital is part of the Northwell family. So the process of a patient getting from Northern Westchester to Lenox is incredibly seamless, especially as we think about Dr. Rene and Dr. Reimers in particular, who spent the last several years there having the relationships there. Carl, is there anything you'd like to add to that?
Just that the cardiac surgery program at Lenox Hill is extraordinary and is definitely, and I think it was just last year, it was ranked #1 in the state for outcomes for bypass surgery. It's an outstanding group. They're very receptive too. It's the sort of thing where if a patient comes in and they need urgent bypass surgery, we would stabilize them here, do whatever is necessary, and then transfer them to Lenox Hill urgently. And we have direct communication with the surgeons all the time.
Excellent. Thank you, Carl. And just to reset, for those of you who are joining us here on Zoom as well as Facebook, I'm Derek Anderson, the Executive Director of Northern Westchester Hospital here in Mount Kisco. We're joined by Dr. Carl Reimers, the Director of our Cath Lab, and Dr. Garvey Rene of Caremount Medical as the co-director. So thank you for joining us. Please help us with, if you'd like to ask a question, please submit that through the Q&A on either Zoom or Facebook, and we're going to capture that. And if the group will allow us, I'm going to go ahead and share some photos of what we're talking about. So this is a picture of the actual laboratory here on the second floor. There are 2 rooms identical to each other as the photos that you're seeing now on the screen. These labs are available 24/7 with fellowship trained level interventional cardiologists, board certified, for the opening of this lab, which is on Wednesday of this week. Please, you can go to nwh.northwell.edu/heart for more information. But we are excited to launch this program here at Northern Westchester Hospital, bringing advanced cardiac care closer to home. There is a question, Dr. Reimers, if you could help us answer this. Somebody asked if we're going to be able to perform ablation procedures or any electrophysiology procedures. And can you talk through that?
Absolutely, be happy to. So we're in the process of hiring a doctor that I know very well to be the director of electrophysiology. We have all the equipment and we have trained the staff for electrophysiology. We will do all procedures with the exception of left-sided ablations, because left-sided ablations, which are done for atrial fibrillation, really require cardiac surgery as a backup. But any right-sided ablations, so for atrial flutter, for PSVTs and so forth, can be done here, as well as diagnostic electrophysiology procedures. I fully expect that this will be up and running sometime towards the end of November.
Excellent. And that's a pretty aggressive timeline, but we're excited to launch this service and immediately start electrophysiology services. So as Dr. Reimers said, the plan is certainly by the end of the year, November, December, we will be offering electrophysiology service as well. I do want to mention Harriet on the Q&A just made a comment that she had a friend who had a heart attack, went to Northern Westchester Hospital, sent to the medical center, and then subsequently Lenox Hill, where they operated robotically. He is 93 years old and he's doing okay. So Harriet, thank you for that. And there was another question. Does NWH have the ability to do robotic surgery? And I'll hand off to Dr. Reimers and Dr. Rene from a cardiac standpoint. I will mention, just as a preface, that Northern Westchester has a long excellence and standard of robotic surgery in everything from men's and women's health, thoracic surgery, all is done here. And we actively have 3 Da Vinci robots that are actively performing robotic surgery every day here at Northern. And if we could, Dr. Rene, could you expand on just robotic surgery, and is that different than interventional cardiology, and what is that? Because there are a few questions on this topic.
Yes, so robotic surgery is different from interventional cardiology. It is a subspecialization of cardiac surgery itself. And there are very few surgeons that can actually do that, you know, and in the end, it is cardiac surgery. It is not something that at this time we'll be doing at Northern Westchester Hospital, but there is a surgeon at Lenox Hill named Dr. Nirav Patel, and that's what he actually primarily performs. So he does what's called robotic bypass, where he actually bypasses one artery on the front of the heart, and he also does robotic mitral valve repairs as well, mitral valve repair replacements. Those are, again, minimally invasive procedures, but a little different from what we do here in the Cath Lab here. However, for instance, those patients, if they needed to have that diagnosis, if they needed to have those treatments, before they actually would meet Dr. Patel and Nirav Patel at Lenox Hill, they would come through us, and we would help those patients with their diagnosis and we'll help them with their treatment. So we probably will still be the first line of connection when the patient will come in and have this problem, and we could help them. Okay, this is what you need. You will benefit more from the robotic mitral, robotic, cabbage in that sense. But this is not something we'll have here. But hopefully, maybe in the next few years, who knows? You could get to that point.
Excellent, thank you. Carl, Teresa on Facebook is asking if every patient will have to be transferred to Lenox at some point in their care. Can you clarify this for us?
Absolutely not. The great majority of patients who come for cardiac care at Northern Westchester Hospital will have complete care, including diagnosis and treatment. I estimate that of 90% of diagnostic angiograms we do, 90% of those procedures that go on to coronary intervention will be done right here at Northern Westchester Hospital. So there will not be a need to be transferred to Lenox Hill Hospital. The patients that require bypass surgery or valve surgery would either be electively scheduled or transferred to Lenox Hill, depending on how sick they were. Also, the 10% of patients who have what we would consider a slightly higher risk for an elective stent procedure, so not something that's emergent, not something for an acute coronary syndrome, but elective. Those are usually sort of chronic total occlusions and so forth. We would schedule those electively at Lenox Hill, but to answer the question, no, 90% of patients who come here will not need to go to Lenox Hill.
So just to reiterate, 90% of patients will effectively get end-to-end comprehensive cardiac care here at Northern Westchester Hospital. Yep. Should the need arise for more advanced cardiac surgery or other subspecialty surgeries, that connection between us and Lenox Hill, because we're in the same family of hospitals, part of Northwell Health, it's a very smooth, seamless transition process. Dr. Reimers, can you just clarify, because there is a question on, are all the procedures in the Cath Lab considered outpatient? And would anyone ever have a need to spend the night or longer than that?
by and large, elective procedures. So patients who come to the hospital electively, meaning that, say you have a stress test that's abnormal at your private cardiologist's office, they think the patient needs an angiogram, a coronary angiogram. So say they're scheduled for Wednesday, September 2nd. They arrive here, we do the elective angiogram and find out, what, if anything, needs to be done. We very much believe in trying to get patients home the same day, even if we put in a coronary stent. So if we can, we definitely try to send them home the same day. Occasionally, for elderly patients or patients who may have some borderline kidney issues who require overnight hydration, we might keep them one night, but the vast majority of patients will either go home the same day or the very next day.
Excellent. Thank you, Dr. Reimers. Dr. Rene, is there anything you want to add to that?
I would say that's correct. Very rarely do patients need to stay in a hospital more than an overnight stay for these elective cases. So again, most patients will go home either the same day or the day after. I do not expect that, but with the exception of the heart attack patients who may stay in the hospital a bit longer, like 2 to 3 days on average, but most patients, like Dr. Reimers said, will they go same day or the next day.
Excellent, thank you. So we want to touch on 2 quick additional topics, which is, let's talk about the nursing care provided in this lab. So the first I want to mention is Pat Soriano joined us almost a year ago to help in the planning stages. Pat is the nurse director or nurse manager of this laboratory, a very experienced, seasoned, almost 3 decades of Cath Lab experience. She is joined by a team of 25 nurses and technicians and Cath Lab technologists that specialize in the Cath Lab. And we have had this team orienting. Many of them come with a wealth of expertise and background within a Cath Lab, within nursing in a Cath Lab, and including the pre and post of a Cath Lab. So that entire experience are coming from other institutions who know a Cath Lab. In addition to that, that team of 25 have been at our sister hospitals in North Shore University Hospital in Manhasset and in LIJ Medical Center, as well as Lenox Hill Heart, which is part of the Northwell family, for the last 10 weeks, orienting to the system, running simulation, running through scenarios, understanding where things are, getting comfortable with the team and the team dynamics. So the nursing care, consistent with the rest of Northern Westchester Hospital, is going to be superior in every way. We are known for our Plane Tree culture, which is everything patient-centered and the patient experience. And this team, once you meet them, you'll see matches and exceeds that expectation. And so we're very excited for the nursing care. I do want to mention Scott on the Zoom chat did ask around the physical rooms. And so I'm going to go ahead and share my screen. For those of you who are joining us one more time, this is Derek Anderson. I'm the executive director of Northern Westchester Hospital. I'm joined by Dr. Reimers, who's the director, and Dr. Rene as the co-director. Scott, we're going to let this cycle through. For those of you who, this is the team that I was referring to. These are photographs from the actual lab. So this is as state-of-the-art as any Cath Lab can get. These are beautiful rooms. Having spent time myself in Cath Labs at the Cleveland Clinic and at Johns Hopkins, these rooms are as modern as you find in any major academic medical center. And the level of sophistication and the level of care right here in our backyard is at that same level. We're very cognizant of what types of procedures require, as Dr. Rene and Dr. Reimers were describing earlier, that require cardiac surgery backup on site. And in those situations, the patients would be transferred to a higher level of care at Lenox Hill Hospital in Manhattan. Otherwise, this is kind of a full comprehensive cardiac center. And you can see from the images and from the team, they are ready to go and enthused to launch this program. So with that, I'm gonna stop sharing for just a moment. I want to get to just 2 more quick questions before we wrap up. First is Judy on Facebook is looking to understand if we are becoming a teaching hospital. And like a few questions before, I'll let Judy from a hospital-wide perspective. We actually welcomed medical students into the facility right after COVID. So we're actively training medical students, prospective physicians. And certainly as our network across Northwell continues and that partnership continues to develop, Northwell and Hofstra have a medical school in addition to the largest residency and fellowship training programs in the United States. When you look at sheer numbers of trainees, physician trainees, Northwell is by far the largest in the United States. And so we will be looking over time to add that complexity, which really further gives us more of a teaching and a training based culture and model. That's for the hospital as a whole. Carl, any thoughts on teaching as it relates to cardiac care?
Well, not at this time, in the sense that I could definitely see that evolving here, but currently there's no plans that I know of to immediately or in the near term future do that. So there are no doctors or medical students in training in the Cath Lab. It's all fully trained people. That could certainly change, and I'm not against it or opposed to it. But at this time, there are no trainees in the Cath Lab.
Yeah, specifically for the Cath Lab. So thank you for making that distinction. We do have trainees on our medicine service, and we may be looking. The other thing I want to mention is Northern Westchester is an epicenter for robotic surgery training. So many of our physicians are what are called master trained Da Vinci robot surgeons. And effectively, we act as a training site, one of only a handful in the United States, for physicians to travel to us to learn the technique of the Da Vinci robot. So I think that's worth mentioning in the context of being a training and an education, a culture of learning. So with that, I think one last question, and then we're going to wrap up. Somebody asked the question, for EMS providers, will we now become a Stemi center? And can you describe what a Stemi is? Dr. Rene?
Sure. So yes, that is definitely one of the main goal of this Cath Lab, was for us to become a Stemi center when we'll be ready from day 1, from September 2nd, to accept a Stemi. So what exactly is a Stemi? A Stemi is a part of what's called an acute coronary syndrome. In essence, for everyone, it's a heart attack. It's a real heart attack that requires us to intervene as quickly as possible, okay? And usually we want, from the time that the patient walks through the hospital door to the time that we open the artery, we want that to be 90 minutes or less, okay? So that's one of the heart attacks that requires a more acute, for us to take care of that as quickly as possible in that sense. And yes, it is something that we will be doing. We've spoken to EMS. Dr. Reimers has met with the EMS team all throughout Westchester, and they know that starting on Wednesday, that they can start bringing all the patients around us to, and we'll be ready to take care of them at that time.
Excellent. Thank you, Dr. Rene, for explaining that. So I think with that, we're going to wrap up. We appreciate the 2 of you joining us to help us officially, via this community webinar, launch the Cath Lab as of this Wednesday. And we are excited to bring this state-of-the-art, high-quality service here to Mount Kisco. And for us, the root of everything we're doing is to produce superior outcomes. Everything else is secondary. And so we are excited and enthused and well-trained and prepared for anything that may present as of this Wednesday. And so, as always, we appreciate the support of the community in embracing more advanced healthcare locally, in supporting us during everything going on for COVID. We thank you as a community for doing everything you are doing to socially distance, to wear masks, to be cognizant and vigilant at this time where we're trying to continue to stop any further spread of COVID. The last thing we just want to mention is in concert with the cardiac cath lab here at the hospital, we are opening in November an outpatient center at Chappaqua Crossing in the complex, the old Reader's Digest building. Northern Westchester, we have a fantastic legacy of outpatient services in that building. And additionally, as of November, you'll see Dr. Reimers there. That will be his home base and others. And so we're excited to open that center as well. And as we focus on women's health and other very important topics as it relates to the heart. Lastly, just a reminder, please do not delay healthcare. Unfortunately, we're continuing to see patients that come to our ER or reach our physicians whose illnesses have advanced to a point where it delayed and it made the illness worse as a result of the delay. So please, the hospital is incredibly safe and clean. Currently, we have actively 1 COVID patient in the hospital. The protocols are such that everything is confined and contained, meticulously cleaned. Patients, visitors, staff are screened upon entrance, and a number of other preventative measures to keep COVID contained here within the hospital. And so we urge you, if you have loved ones that need medical care, please don't delay as we see some of the effects from a public health standpoint, byproducts of COVID. So that's just one of our key messages today. Again, thank you to Dr. Reimers. Thank you, Dr. Rene. We appreciate you having you this afternoon. We are excited for this lab. Thank you for being here. And we thank everybody who's joined us remotely today. And I'm going to end with one last comment from Scott on the chat, who said, thank you so much for your efforts and dedication. I know those who know the complexity of launching a cath lab appreciate your efforts. Good luck. And with that, thank you to our community. Thank you to the both of you, and have a great evening.
Thank you.
Take care.
You too.
All right, take care. Bye.
Bye.